All right, testosterone and male infertility. Talk to me.
Right. So the first thing is that, interestingly, if you take testosterone from the outside, that will usually shut down or certainly decrease dramatically the sperm that a man's make.
I've heard it's like a male's birth control.
Yes, it's the worst of both worlds, though, because it definitely impedes fertility, but it doesn't cut it out completely. So you can't rely on it as birth control. So it's and what happens is, the reason is that in order to make sperm, the testosterone that a man has to be made in the testis itself. The testis needs a very high concentration of testosterone in order to make sperm. So if you give testosterone from the outside, it shuts down your own production of sperm, and then that decreases the production, it decreases the testicular production of testosterone. And if that means that you don't achieve a high level of testosterone in the testis, which means that you shut down or certainly, decrease the production of sperm. We can give men with low testosterone levels medications, specifically clomiphene citrate, Clomid, or HCG, which then push the testes to make more testosterone, and that can sometimes improve the sperm production and make them feel better as well. But I do get a lot of men who have been on testosterone, either self-prescribed or by their doctors, who were not aware of the fact that it shut down sperm production. And then we have to get them off of it. And sometimes they're not very happy as they're coming off of it. But we try to give them the other medications that will make them make their own testosterone, so at least they don't bottom out their testosterone when they're coming off the testosterone.
That's a lot. Huh. And when should people be getting testosterone? Like when is I know that many men have low testosterone symptoms, or they think they do, or their doctor tells them. At what point in their life should they be
on testosterone?
Testosterone.
Yeah, so I'm a great believer in testosterone. And so, but basically you're not treating the number, you're treating the patient. So if a patient comes in, let's assume that they're finished with fertility, so we don't have to deal with sperm production, right? Okay. So you get a 45-year-old man who comes in and has symptoms of a low testosterone. The symptoms,
like what?
Yeah, so the classic symptoms are decreased energy. For me, if a man in his 40s or even 30s or 20s is taking a nap in the middle of the afternoon on a work day, we have a problem. Okay, so decreased energy, decreased libido. So so he still loves his partner, but and finds him or her attractive, but just doesn't want to have sex with anyone. That's a very good sign. It can have a modest effect on erections, but that's not necessarily. And it can be difficult to take off fat, put on muscle, get themselves to work out. And also they can sort of have a brain fog where they're just not as sharp. Working backwards, if they have a low testosterone and they have a significant number of symptoms, and we put them on testosterone, 90% of the men will feel dramatically better. And so that's nice.
That's amazing. And what are some of the methods that we use for testosterone?
Right. So just to backtrack a little bit, so I am more aggressive than most people. So to me, if normal range is 300 or below, I'm not trying to get them to 320. I'm actually trying to get them to 600, 700, 800, which is when they feel better. And also, it can take a while before they feel better. So I sort of have a verbal contract with men. It's like, we have to do this for a year before you decide whether or not you've had an improvement. Usually it does not take that long, but I tell them it takes 3 or 4 months to notice energy, 6 months to notice a change in erections, and up to 9 months to notice the change in libido. Wow. So I get a lot of men who've come in, they've had a low testosterone, their doctors give them a low dose of the topical for a month, they don't feel better. Their numbers went from 220 to 370, and they say, well, this doesn't work for me. And that, of course, in my mind, is not a real trial. Back to your question about what the options are for treatment, there's a lot of them. There are topicals, which you can put on every day.
Okay.
You want to make sure that those don't get on your partner if she's a woman, and on your kids, and especially if she's pregnant. I find actually a lot of the men start with that, but then don't like it. They don't get good absorption, or it's annoying for them.
Mm-hmm.
There's one that, I mean, I can go, there's literally about 10 different
Oh,
ways.
wow. Okay.
Most of the time it boils down to the two that I like the best are once a week, they can give themselves an injection. It used to be
Mm-hmm.
thought that they had to give it in the muscle, but actually you can give it in the fat, believe it or not, which is sort of cool and less
Okay.
invasive. And the second one that we use, which is bioidentical, are we put in pellets, these little, they look like a grain of rice,
Mm-hmm.
uh, in the skin above the tush once every 3 months. And that works quite well. Yeah, it's fun.
The things we do for our
Yes.
bodies.
Well, the men feel dramatically. It's a game
Yeah.
changer for the men and for their partners, because
Well, I know it's just not only about this, about sex. I think it's also about just feeling blah.
yeah,
So
right.
yeah, I think that's really helpful. Amazing. All right. Well, Dr. Werner, thank you so much for your time. Is there anything else you would like to leave our community with? Any wise words?
The only thing I would say is we do
Yeah.
get men coming in all the time with really, terrible semen analyses. So
Mhm.
one of the things that, again, no one can guarantee people a baby, but I would say that in my experience, if the age of the woman is good and the man has any sperm
Mhm.
and they are proactive, the vast majority of couples do conceive using, their gametes. So it's as distressing, people are really on the floor when they come in with these terrible semen analyses. And I don't want to be a Pollyanna, and we can't guarantee anyone a baby.
Right.
But the vast majority of people do end up successful. The key is, again, once you want to have children, don't, do it sooner rather than later.
Yep.
I'm in the, like the younger the better, as long as you know it's the right partner, because you have a better chance of conceiving more easily. It's healthier, and what are we waiting for exactly? So
Yeah. Well, that's reassuring.